I've started to incorporate using nerve protectors, nerve wraps, more over the last, I would say, 4 years or so, especially being in a level 1 trauma center where we see high level traumas. I feel that it's important to protect nerves, even in the absence of current clinical data, because of the injuries that we see. If you have a severely damaged wound bed that nerve's sitting in, that's already predisposed to potentially have a bad outcome because of that amount of damage that's around the nerve. And you can see that oftentimes based on if there's hematoma around, if that nerve that's injured is next to a structure that's injured directly next to it at the same level versus a different level. Those areas I think are very important to protect. If you don't put anything, even if you do a perfect repair, there's likely some fibrosis, some adhesions that are going to happen near there. So if I have a wound bed where it has a fracture that I've had to deal with maybe a tendon or muscle laceration as well, I know that nerve is going to be caught up in a good amount of fibrosis. And so I want to protect that the best I can to allow that nerve to glide, to hopefully get the best outcomes that we can with that. And so protecting it, in my mind, makes sense, but you have to do it in the correct way, right? And so there are concerns that if you put the wrap on too tight, right, and especially if you're doing that when the tourniquet is up, and then when you let the tourniquet down, that nerve swells, that could potentially strangulate the nerve. And so we have to make sure that when we put these on, that we put them on with some space, right, to allow that to occur. Or we do it when the tourniquet is down to get a better idea of what that nerve truly looks like in a normal setting. And so doing what we can to put that nerve in the healthiest position we can, I think, is of utmost importance. And so when we have these high-level traumas and we have products that allow us to protect them that are on the shelf, easy to obtain, and that are cost-effective, for me, it makes sense to do that, to give that patient the best potential outcome.